Bharat.
Yeah, I'm Dr. Bharath, consultant urologist from TX Kachiguda.
Dr. Bharath Reddy, we all know that kidney stones can reoccur in a patient. What is your advice for people to follow so that it doesn't come again? Hopefully.
Actually, the percentage of recurrence, if you see nowadays, in a 5 years, there is almost a 30% recurrence of stones.
That's quite high.
Yes, even if you consider a 10-year recurrence, it's almost 50 to 60%. So, the person, there's a myth even among the patients. They come and ask me, sir, if I get operated for a stone, they say that the stones keep forming again. Is that true? But actually, what's the picture is they have the tendency to develop stone. That is the reason they get the stone again. If you don't get operated, from the urologist point of view, that is the main reason which actually leads for the kidney failure.
Okay.
From urology, from surgeon's point of view, that is the highest reason. And coming to the prevention, the first and the best thing for everyone is hydration. So that is what prevents the stone. So the most important factor among hydration is he or she must be able to pass more than 2 liters of urine. That is when everything gets cleared.
Okay.
And the chance of stone formation will be less. So it doesn't differ whether you're having a hot water, soft water, it doesn't matter. But the amount of urine which the person passes out should be more than 2 liters. That is what hydration does. And this is the cheapest, best way, and everyone can do that to prevent stones.
Correct.
And coming to the dietary modifications, like there's again many people keep asking me calcium. Actually, people ask me, should I stop having calcium? Actually, what actually happens is calcium and oxalate both together get combined. So if you have very less calcium, then you have chance of oxalate stone formation. If you take very high amount of calcium, you can have calcium stones formation. So the moderate amount of calcium is what is essential. And coming to oxalates, they say that spinach, some almonds and nuts, these all contains high amount of oxalates, which eventually again leads to oxalate stone formation. So the
spinach.
Yeah, spinach.
Poor spinach.
Yeah, the person.
Such a sweet little thing it is.
Yeah. But
I love spinach.
And even the nuts. See,
nuts, I love nuts.
Yes.
My biggest weakness is nuts.
Luckily, you hydrate more, so I don't think.
I drink a lot of water, but I eat a lot of nuts. The first thing in the morning I do is I eat nuts.
Yes, many people do have that, but I think they also maintain the hydration, so they don't get any stones. And the inherent property, the genetics and metabolic property in the person should be there for a stone formation. That is one other thing. And coming to supplementation, many people take calcium tablets, vitamin D tablets. That should be in a moderate amount, and that should be supervised by a physician. They shouldn't keep on supplementing by themselves. That is one other thing. And coming to probiotics, it's like there are a few bacteria like oxalobacter, lactic acid. These actually help in decreasing the oxalates, which eventually.
So probiotic is good.
Yes, probiotic is good, and it plays a role in decreasing the stone formation. See, one other thing from urologist point of view is that even anatomical abnormalities, like if they have a prostate, the urine has to be cleared out in a faster way. If it's not clearing out, then it leads to supersaturation and formation of stone. If they are having a problem like a prostate or an abnormal drainage, then the chance of stone formation in them will be very high, and they are very prone for a recurrent stone formats. Yeah, and there are many other ways like stone analysis. When we clear a stone, then we can send that particles for an analysis. Even that gives us an idea which type of stone it is and what we can do. And some measurements of investigations like in uric acid. If the stone is uric acid prone, then we can even give some medication so that we can avoid the recurrence. So these are few things which play a role in decreasing the recurrence of the stones.
Interesting. But the supplements, are they really, really bad? Like if you overdo it?
Yeah. I have seen people, even the orthopedicians and even the gynec people, after they undergo uterus removal, like hysterectomy, then they keep on supplementing calcium. They should also question that if the patient has a stone former. If it's a stone former, then they should keep in mind that his calcium should be given moderately. These things.
And what about these kids who are like putting injections in the body that easily?
Even the people who are hitting gym have been taking more amount of protein. The more the protein they consume, the more they are prone for chronic kidney disease. So the amount of protein should be limited. What actually the guidelines say is that 1 gram of protein per kg per body weight is the maximum amount of protein.
Yeah.
That is what they consume can decrease stone formation.
So if you're like 50 kilos and maybe 50 grams, is
yes,
that
50
all you
grams.
need?
Yes, that is it. And the amount of water intake should also be moderated according to person's weight and his condition. If he is a cardiac patient, then the water should be decreased. So something around 2.5 to 3 liters is a good, decent water intake in general.
Thank you, doctor.
Thank you.